Welcome to Toronto Children's Services Exclusion of Ill Children and COVID-19 Cases Tips and Consideration Training Module. All reasonable precautions must be taken in the protection of the staff, children and families when there is a suspected or confirmed COVID-19 case in childcare. This module will review what to do when a staff, child, or household member or close contact of a staff or child shows signs or symptoms or tests positive for COVID-19. We will cover how to exclude children, communication, reporting, and practical considerations to ensure that we can continue to operate safely. Childcare centres and home childcare agencies will need to create a procedure for what to do if there's a suspected or positive case of COVID-19 within the childcare centre or home childcare setting. Ensuring that there is a consistent monitoring of environmental conditions, signs and symptoms of illness in staff and children, and all procedures are followed is essential in preventing and reducing the spread of COVID-19. Monitoring is achieved through screening for illness upon arrival. Home childcare providers can screen over the phone or via video conferencing, and through recording of symptoms for each child and staff, including signs or complaints the child may describe, date and time of symptoms occur, attended room, including others within the room cohort, and attendances and absences. In this section, we will review the steps you must take when a child presents symptoms related to COVID-19. When children are ill or exhibit COVID-19 symptoms, staff and providers must separate the ill child from all other children and bring them to the designated exclusion room or designated exclusion space for home childcare. Notify the parent or guardian of the ill child, detailing symptoms and requesting pickup of the child immediately. Supervise and monitor the child until they are picked up from care by the parent or guardian. Record the symptoms in the child's daily record and in a daily log. If it appears that the child requires immediate medical attention, the child must be taken to the hospital by ambulance and examined by a qualified medical professional. Excluding and separating a child with COVID-19 symptoms. Immediately separate them from the rest of their group in a designated room or space and supervise the child until they are picked up. Notify parents or guardians to pick up the ill child as soon as possible. The designated room or space should have a hand-washing sink or alcohol-based hand sanitizer available. Children older than 2 years old should wear a mask if tolerated and if they are able to use it properly, for example, donning and doffing carefully and avoiding touching it. Childcare staff and providers supervising the ill child should maintain physical distancing as best as possible and wear personal protective equipment such as a surgical mask and gloves. Consider wearing eye protection such as goggles or a face shield if staff determine that there is a risk of exposure to droplets, for example, if a child is coughing or sneezing. Clean and disinfect the area immediately after the child with symptoms has been sent home. Symptomatic staff and children should be excluded from the childcare centre or home childcare and attend an assessment centre for testing as soon as possible and isolate at home until their results are available. Information by Toronto Public Health on how to self-isolate properly should be provided. Other children or staff who have been in contact with a suspected COVID-19 case should be identified as a close contact, monitored for signs and symptoms, and remain cohorted. During this period, they should avoid contact with vulnerable persons or settings such as long-term care homes. Individuals with symptoms who test negative for COVID-19 must be excluded until 24 hours after the symptoms resolve. When a child or staff has been excluded due to symptoms related to COVID-19, complete a serious occurrence in the childcare licensing system, report clusters of suspected cases, for example, 2 or more children or staff with COVID-19 symptoms within a 48-hour period, to Toronto Public Health Surveillance Unit. Symptomatic staff and children should attend an assessment centre for testing as soon as possible and isolate at home until their results are available. This section will outline the steps you must take if a staff, child, or close contact of a staff or child shows symptoms or tests positive for COVID-19. When a staff or child has a positive test result, provide tracking lists, names, and contact information of families and staff who have been excluded to Toronto Public Health at 416-392-7411. Take direction from Toronto Public Health on who should be excluded. Ensure incident occurrences and WSIB reporting is completed and the serious occurrence is reported on CLS. Designate a main liaison for Toronto Public Health and other partners who will provide direct support to the childcare centre and home childcare. When a staff tests positive for COVID-19, the staff must inform their supervisor and home visitor, self-isolate immediately, and cooperate with management and Toronto Public Health to identify close contacts. All staff and children who are in the same room as the ill staff will be excluded for 14 days. When a child tests positive for COVID-19, the parent or guardian must inform the childcare centre and home childcare immediately. All staff and children who are in the same room as the ill child will be excluded for 14 days. When a close contact tests positive for COVID-19, staff or families who have been in close contact with a positive COVID-19 case must inform the childcare centre or home childcare provider immediately. The staff or child must self-isolate and will be excluded from the childcare centre or home childcare for a minimum of 14 days to monitor symptoms. The staff or child will be contacted by Toronto Public Health to provide resources for the isolation period. Staff and children who are being managed by Toronto Public Health, for example, confirmed cases of COVID-19 or close contacts of cases, must follow their instructions to determine when to return to the childcare centre or home childcare. That concludes the Exclusion of Ill Children and COVID-19 Case Training module. Please inform your supervisor, director, or home visitor that you have completed this training module. We have provided a list of additional resources for you to access. They can be found on the website along with this video.